We are live now, doctors.
Okay.
Yeah. Good evening, everyone. Welcome to Shield Connect webinar, The Icons in Conversation with Dr. Ritu. Today, our topic is nipple discharge. Is it a sign of breast cancer? For this Icons in Conversation, our organizer is none other than Dr. Ritu Santwani, ma'am. Dr. Ritu ma'am, no need any introduction, well known by every one of us. But still, I want to introduce ma'am. Dr. Ritu ma'am is an obstetric and gynecologist, founder and CEO of 360 Degrees Healthcare Studio, and infertility specialist, and co-founder of MAM and board member of SWWC. And today, our speaker is Dr. Tarani Taneja ma'am. Dr. Tarani Taneja ma'am is chairperson Delhi State ISAR and president OB-GYN Society of UP State and chairperson of ISAD, that is Indian Society of Prenatal Diagnosis, Perinatal Diagnosis and Therapy. And ma'am also held many posts like international member of FIGO Working Group Breast Diseases and FOXI chairperson of Breast Committee. Ma'am have lots of awards to her credit and lots of publications also. I'm handing over the session to Dr. Ritu ma'am.
Thank you, Chitra, and thank you, Shield Pharma, for providing the platform for this program from last 3 years. So, a very, very warm welcome to our very dear Dr. Tarani Taneja ma'am. So, madam is recently awarded by the Dr. Kuti's prize also. So, madam is a big congratulations for that also. So, before I will hand over the slides to dais to ma'am, I will also want to share something about madam. So, first I will share my screen. So, yes. My slides are not visible, na? What happened? Yes. First of all, a very, very warm welcome to all of my dear friends who have joined all across the geography. So friends, as we all know, this is the common time of Navratri is going on. So we will start our all presentations with Mata Durga Stuti. Ya Devi Sarva Bhuteshu Chikitsa Rupen Sansita Namastasyai 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 Namo Namah.
आए मैया के नवराते हो रहे घर घर में जगराते आए मैया के नवराते हो रहे घर में जगराते.
So friends, as we all know, this October month is celebrated as the Breast Cancer Awareness Month.
आए मैया के.
So, namaste to all of dear friends and salam alaikum to all the friends who have joined from the Arab countries and Bangladesh. As just now, dear Chitra has introduced the madam, but I think madam's introduction is still incomplete. Madam has done lot of IUI workshops, and she has organized the National Gynec Update in October 2010, and she is invited as speaker for so many national and international conferences. And madam is scientific chairperson for ISPAT Delhi State, ISAR Delhi State, UPCOG Greater Noida midterm, and organized many webinars, national and international. So with me, the madam's connection is little different. Jisko bolte dil ka dil se rishta. So madam, is a small video for you.
धागों से बांधा एहसास दिल के रिश्ते का, रिश्ता ये अपना रब की रुबाई. मैं रहूं ना मैं तेरे बिना. धागों से बांधा एहसास दिल के रिश्ते का, रिश्ता ये अपना रब की रुबाई. मैं रहूं ना मैं तेरे बिना.
with this, today's topic is very
Dhab-
regarding this nipple discharge. Lot of queries everyone is having in their mind, whether if this discharge is cancerous or non-cancerous. And related to the breast lump, also there is a lot of fear in everyone's mind that is the all lumps are cancerous, or is the breast cancer is only limited to the females, or it can happen to males also. And what does the color of the nipple discharge shows, and what is the significance of that? So this is a very, very important topic. And so today, madam is with us to enlighten on all this. Post that, I request all the friends who have joined, please write your questions in the chat box. Post the lecture. I will take all the queries. Now I will stop sharing. Warm welcome to all the friends, those who have joined. Yes, madam, over to you. Yeah. And yes, welcome. Dr. Shivani has joined from the Delhi. Dr. Anuradha from Aurangabad. So many friends have joined. Dr. Archana Khurana, Dr. Arpana Agarwal, Dr. Nayak, Dr. Usha Madan, Dr. Amita. So many friends have joined. A warm welcome to each and everyone. Dr. Aparna, hi. Yeah, madam, over to you. Tani, madam, over to you. You can share your screen. Madam, you are muted. Madam, you are muted. Voice is not audible. I think there is some problem with the madam's net connection. So
Yes,
friends,
ma'am.
meanwhile, we all, yeah. So friends, as we all know, this October month is the breast cancer awareness month. So a lot of queries in everyone's mind related to this breast cancer. So I want to know everybody's opinion that how many of you are advising your patients and yes, madam has joined. Yeah, madam, over to you. Madam, can you hear me?
यहाँ पे पढ़ा करो यहाँ पे इस तरह पे
Madam, can you hear me? Yeah, what I was telling.
So
that
Ritu is
regarding
okay,
this-
पर शेयर कहाँ
Yes,
से
yes,
होगा?
ma'am, perfect.
शेयर
Yes, ma'am, you can
शेयर
start
नहीं हो पा
sharing.
रही, शेयर के लिए तो इधर ही करना पड़ेगा. So Ritu is audible. Am I audible?
Yes, yes, you are audible, ma'am. You are audible.
Okay.
Slides are okay.
So first of all, many thanks.
Slides पे पूछ लो.
Many thanks, dear Ritu, for showing the beautiful and memorable moments. I'm really touched, and it really is reminding the
You're most welcome,
with
madam. Most welcome.
Shilpa also, dear Shilpa also.
Thank
She
you,
is
ma'am.
not
Thank you.
here, but we could remember that moment. So first of all, I really to all the delegates, national or international, all your friends and your friend Dr. Shivani. So first of all, congratulations to you for taking such an important issue in this month of breast cancer awareness. Though every moment we should aware about the lead even over the cervical cancer. So many congratulations. It's a very important issue. So I just start with we should believe, hope, and can fight breast cancer by awareness and early detection. So if we make aware our society, our women, our patient, definitely they will come for the early examination. If any pathology, any lesion is there in the breast, we can detect in the condition where it is treatable, 100% curable. So that's why we are doing more cancer awareness. So October is the breast cancer awareness month. The topic is the nipple discharge. Is it a sign of breast cancer? Those are very little discussed. This is very important issue. Around 70 to 80%.
Madam, sorry to disturb you. Slides are not visible. Slides are not visible.
Okay.
No,
Yes,
not
sir.
visible.
So what to do? Can she help, Chitra?
Chitra, can you help, ma'am? Meanwhile, welcome Dr. Kariman. Dr. Kariman is president of Lebanon Society. She has joined from Lebanon. Dr. Renu madam
So I
has joined
understand.
from Kanpur.
Okay.
Can you see the slides now?
No, ma'am,
No,
not yet,
no,
ma'am.
We are again trying to छोटा सा दिखा रहे थे.
Yes, madam. Now it is coming. Yes, ma'am. Now
Is
it
it
is visible.
visible?
Yes.
Now it's a full screen?
Yes, it's perfect.
Wow.
Perfect, ma'am.
Yeah.
Perfect,
So
ma'am.
topic is the nipple discharge. Is it a sign of breast cancer? So these are actually, I was scrolling my phone. I got two pictures. These I'm just, it's a proud moment to me also, attending the breast care group of the International Federation, FIBO, at the Frankfurt. So everybody is in the pink because the pink ribbon is the symbol of the breast cancer. So that's why I just took this slide, just to show the significance of the pink color. So introduction, the breast is more prone to be altered by environmental carcinogens. It's a dynamic organ, undergoes cyclical proliferative changes throughout life under the influence of hormone and growth factors. Now, increasing number of women attend OPD for the evolution of the breast problems, that is a nipple discharge, pain, tenderness, lump, with the fear of breast cancer. So one day I was just wondering why so many, women, at least one or two women, they also attend my OPD, though I literally don't encourage because I more into infertility, laparoscopy, ultrasound, and IVF. So even that they are coming. So one day I just asked them. So just I could know it is just after the following mastectomy of American actress news on media. They have literally sensitized the society. Angela Jolie's mastectomy. So media has published the case in a big way that has created great awareness about the breast cancer morbidity and mortality. So it came to my mind that whenever we want to make awareness, beside the public awareness, we should take the media along. So news from the media, it goes in a large way and people get aware themselves. So now come to the topic Dr. Ritu already described in a good sentence. So nipple discharge is any fluid that comes out of the nipple area. It may be either from one breast or from both the breasts. It is a common symptom that around 70 to 80% women complain during their lifetime. It's most common in women or people assigned female at birth, in late pregnancy, and immediately after childbirth. So just to specify again the definition of discharge, when secretions are abundant, they are persistent enough to leak or expel spontaneously from duct orifice of the breast, it's called the discharge. It can be physiological or pathological. If ductal system on touch is not affected, is not tender, it's a physiological. If ductal system of the breast is showing pain, the patient is complaining the pain, or it's tender, rather affected, then it is pathological. as the Dr. Ritu already said about the color of the discharge, they also signifies many times about the problem, but there may be different type like yellow, mucinous, milky, bloody, purulent, multicolored, and sticky. What is the significant when it is very clear white and bloody and blood tinge? Then it is significant for the breast cancer. It may occur spontaneously or only in response to breast manipulation. So causes for normal nipple discharges are hormonal, lactational, or sexual arousal. But for abnormal discharge, there's always presence of tumors, infection leading to abscess or breast cancer. It is always abnormal in men. What kind of nipple discharge is abnormal? When it occurs spontaneously, that is without any manipulation, it occurs only in one breast, that is unilateral or bloody in color, then it is very, very significant and it is termed as the abnormal. Conditions that may cause abnormal nipple discharge include papilloma, that's a non-cancerous breast tumor, Paget's disease, this is the disease of the skin, resembles to the eczema of the breast, and breast cancer. What does breast cancer nipple discharge look like? Nipple discharge, that's a bloody or clear may be a sign of breast cancer. This is especially true if it is leaking from just one breast. Just mind when it is from the one breast, unilaterally. This is the discharge, bloody discharge, leaking from the nipple of one side of the breast. People with nipple discharge due to cancer often feel a lump on their breast as well. Abnormal nipple discharge that can be from the other health conditions, the other breast infection or abscess, severe underactive thyroid gland, pituitary gland tumor, cancerous breast tumor we already discussed, and intraductal papilloma, Paget's disease. They are very, very important along with the breast cancer. These are the picture of the intraductal papilloma mammographic picture. It's a common presenting symptom for intraductal papilloma includes serosanguinous discharge or a palpable mass. What is the treatment of this? It's a very easy. Suppose if it diagnosed on the mammography or MRI, on the core biopsy, it can be taken out. If it still persists or it is bigger in size, then the duct has to be removed to cure the patient and to confirm the diagnosis. Paget's disease, that is the skin infection, is resembled to the eczema. There are the 4 pictures I had taken. The picture A and B, they show how it looks on the appearance, and C shows the ulceration on the nipple, and third shows the advanced state that is spreading on the whole of the breast. In the literature, almost all patients treated with the local excision, radiotherapy, or both had the clinical presentation of Paget's disease without a palpable mass. So it is very, very alarming condition. Whenever it is eczematous sign on the skin, we should not overlook. We should take it seriously and should get the consultation and proper evaluation to exclude the Paget's disease. Evaluation of women with a suspicious discharge with the goal to exclude cancer or establish an accurate diagnosis for better management. In the evaluation, what we do on the basis of thorough history, physical examination, and relevant investigation, History we have today either is unilateral or bilateral, is spontaneous, or it is provoked. Provoked is not specific. Detailed history of medication, because there are so many medication, they can create the discharge from the breast. The commonly known medications are anti-epileptic, antipsychotic, antidepressant, and oral contraceptive pills, what the most majority women take in abundance. So the detailed history is very, very important. We also take the history of menstrual cycle to exclude the presence of prolactinoma. This is the tumor of the prolactin. Then we also take the history of hypothyroidism, because hypothyroidism also one of the cause for the nipple discharge. The past medical history, again, very important to see if there is any lesion on the breast, any biopsy, anything has happened in the past, or family history, if there is any close relation, they are suffering from any type of cancer, breast cancer, colon cancer, is a very closely related to the breast cancer. Then we also ask for any mass or examine, also ask the patient if there is a pain associated with the discharge. In the physical examination is focused on the breast examination. In male patient, we have to look for the gynecomastia. If gynecomastia is present, it has to be noted, and patient has to be queried in detail and should be referred to the higher centers where the breast surgery is done. Breasts are inspected for the symmetry, dimpling of the skin, erythema, swelling. It has to be examined thoroughly in detail for any abnormality on the nipple, on the areola, on the breast tissue. If there is any ulcer, crusting over the breast, this all has to be noted down. Even the retraction of nipple is very, very important, is rather a sign of the breast cancer. So proper examination of breast for the presence of mass. And beside this, we have to look for the lymphadenopathy. The site for the to look for the lymph nodes are the supraclavicular region, axillary region, for the presence of any lymph node. So doctors apply when the patient comes, so I'm not going to tell, pressure around the nipple, check for the discharge, and when this discharge, is it containing blood or not? And the histopathology is taken, cytology is also taken, just to see if there is any presence of the cancerous cell. When the patient go for the examination, the clinician also asks, though breast examinations is done in many conditions, many positions, like in the sitting position, standing position, and when we keep the elbow on the waist, in that condition, when clinician examine for the nipple discharge, they ask the patient, because she maybe press her palms together in front of the forehead. It's a very important. Why? This position makes the chest muscle contract and makes subtle changes in the breast more noticeable. So this position to check the discharge or breast lump are very, very important. So these are the signs, just picturized in the way. There's a contour is changed because of the presence of lump. There is a change in the size. It has become bigger. Then discharge, it's a bloody discharge. Then there is a redness, erythema over the breast, nipple, and there are change in color or appearance of the areola. Then there is an inversion of nipple. So these all signs has to look thoroughly. What are the red flags? certain findings are of particular concern, probable breast mass or skin changes associated with the nipple discharge. There may be the bloody discharge, unilateral discharge, spontaneous discharge, and the age around 40, or if it is in male sex, is very alarming, the urgent attention to be given. For the testing of the nipple discharge, the appropriate workup may include hormonal level like serum prolactin and TSH. Subareolar ultrasound has to be performed, mammogram, cytology, FNSC, biopsy. And contrast enhanced MRI, ductography. What is ductography? When we give injection in the particular duct and take the X-ray. If endocrine causes like prolactin and thyroid are suspected, the following are measured: prolactin level, thyroid stimulating hormone. After exclusion of hormones, that is thyroid and serum prolactin, the cytology of the lesion is carried out. Ultrasound is also very important tool, rather to say golden tool, because it's non-invasive and very easily available, and patients are very comfortable to get it done. So if there is palpable breast mass, evaluation may include ultrasonography, and it is good under the age of 40. Beyond the age 40, mammography is advised. The reason behind is this: under 40, the breast tissue is very dense, and the findings are good on the ultrasonography. But when the breast becomes loose, the density becomes lesser, the findings on ultrasound are not good. In that case, patient is advised for the mammography. So if there is any cyst on the ultrasound, it can be aspirated. If we think aspirate is not much in the cyst, is not adequate, or we feel there is a visible duct, because ultrasound is a good tool to focus on the duct that is abnormal, then in that case ductography can be done. And if we are more suspicious about the risk of the cancer, any malignancy, or we think there is a history of gene mutation that increase the risk of the breast cancer, in that case patient is advised for mammography under the age of 40, and above the age of 40 to 40 years, the option to be annual screening by mammography, and beyond the age of 45 up to 54 years, annual screening is advised. From 55 years beyond, screening every 2 years should be advised. Then still patient and clinician not satisfied and risk of cancer is there, then in that case MRI can be done. It is used to do the following: to diagnose abnormalities in the breast, especially in women with the dense breast tissue. Or there is, again, as I told you in the previous slide, when we think there is a risk of the breast cancer, high potential patient is a high potential for to develop the breast cancer if there is a history of mutation in the family. So ductography is useful to identify secreting duct. I just told what is ductography. We just inject the dye and take the X-ray of that duct. If an ultrasonography and mammography, we don't identify source and the discharge is spontaneous and comes from a single duct of the one breast, so evaluation may include ductography imaging. Is a image guided biopsy should be done. So biopsy are of different type. We can do FNSC for the cytology, that true cut and core biopsy and lumpectomy also can be done. If lump is very big and suspicious, in the core native biopsy of breast lump is very important. What is core native biopsy? In the core of tissue taken from the suspicious lesion to be examined, is a book. Needle, in this case, needle is used of larger gauze that is able to get a core of tissue inside the needle. There are different gauze needles, 18, 16 or 14 can be used. The higher the number, the smaller the needle size. What is the procedure for this? First, to anesthetize, locally anesthetize the patient, to numb the area before insertion of the needle. A small nick in the skin is made and the needle is inserted through this nick. There are special types of core needles biopsies. They are the stereostat core needle biopsy, vacuum assisted core biopsy. Vacuum assisted core biopsy is also important to take out the whole intraductal papilloma if it is diagnosed on the mammography or MRI. If lesion or mass is unable to see or feel, then it should be done imaging guided and ultrasound, guided or X-ray or CT scan can be used to help find the area to biopsy. So this is a small video of showing the core biopsy, how we do after just doing the local anesthesia. This like a potato is symbolizing the breast. So we just put this needle, took the tissue. Now this tissue will be transferred in the tube and media has been provided by the pathologist. And this is again sent to the histopathologic examination. So how is nipple discharge diagnosed? Diagnosis depends, just to give at a glance, diagnosis depends on the thorough physical examination, relevant investigation, imaging like ultrasound, mammography, FNAC, magnetic resonance, ductogram to read to find a cause in highly suspicious cases. Biopsy, if a physical exam or imaging test show an abnormality, biopsy to be done to confirm diagnosis. In the case of pathological nipple discharge, diagnostic mammogram and subaural ultrasound are the imaging modalities of choice. If no abnormality on ultrasound or mammogram, examine every 6 months for 2 years or until the discharge resolve. As the risk of carcinoma is also there, though it's not very high, but around 3% is there. So in the presence of an imaging abnormality, biopsy is recommended to evaluate the cause of the nipple discharge. Surgery is also indicated to remove the affected duct and underlying lesion in order to rule out presence of an associated carcinoma. As risk of carcinoma is there, so surgical therapy is done to excise the duct to individualize on the duct's condition. If it is severe, pain is severe, and discharge is also profuse, then surgical therapy, that is the duct is removed. How is nipple discharge treated? The treatment for nipple discharge depends on the cause. Positive history of taking some known medication to cause nipple discharge, to change or stop the medication, removing a lump or cyst if it is present there, taking out a milk duct, medications like antibiotics for breast infection leading to abscess should start, treating the condition causing the discharge. If there is no apparent cause for the nipple discharge, in these cases, you may not need any treatment. Leaving the nipple under observation and not warn the patient not to excuse them may be the only treatment. A follow-up exam, a mammogram, just to be sure within a year should be advised. So key points is Spontaneous unilateral discharge requires diagnostic testing. This type of discharge may be cancer, particularly if it is bloody. Presence of a breast mass, a bloody discharge, or history of an abnormality on a mammogram or an ultrasound scan requires follow-up with a surgeon who is experienced with breast disorder. Nipple discharge is most often benign. Bilateral, multiductal discharge is usually benign and has an endocrine etiology. We also, I think one slide has been deleted by mistake of this galacturia. We usually see the complaint of the patient, the milk discharge from the breast. In that case, we just advise the serum prolactin level and thyroid TSH level. If the serum prolactin level is higher, or on giving the therapy, that is the bromocriptine or capgolin, and after repeating the test, if the patient is complaint is prevented, there's no discharge, then we can leave the patient and continue the capgolin for 6 weeks. But still on the capgolin, discharge is continued. In that case, we take the X-ray of the pituitary fossa to exclude the pituitary tumor. As we all know, prevention is better than cure. The preventive measures, I usually do the public awareness camps, rallies at large scale with the media, with the administration, and proper teaching also for breast self-examination. Though breast self-examination is not going to pick up, but it's make the patient more aware about the problem. If she is having little bit problem, she will do the breast examination. If she find suspicion something, then she can urgently report to the doctor. And detailed information to follow guidelines for the breast checkup should be told patient, and promote breastfeeding for good health of baby and to reduce risk of breast cancer. Fight cancer. If we knowing it exists is not enough, we should get informed ourselves and pass it to the relatives, to the friends, to the society, whoever comes in our context. If breast cancer increasing is a very fatal cancer, if detected early, it can be cured. Otherwise, there are very morbidity and mortality. Morbidity is when mastectomy is done, then it's a very cosmesis of the femininity is disturbed. And definitely it's a long-term chemotherapy, radiotherapy, and so many things patient has to undergo for this procedure, and the life is literally go hell. So this is the picture just to tell the patient how the breast self-examination is done. We should tell the patient that every condition, and what is the important point for breast self-examination? It should be done just after the cycle, because before the cycle, the breasts are already engorged because of the water retention, so they are tender. This can't be done smoothly. It should be done like in the, before going to shower. She can do in the bathroom, taking the shower. In the mirror, she can see the size, color. If there is doubt, she can press also. And if she feels there is any doubt, and sometimes she feels, sometimes she doesn't feel, then in that condition, it should be done on lying down position, so the all tissue is spreaded and the lump is very easily noticeable. So this is very important to make the aware, and the patient, to make the patient aware and to take care of herself. Now the question comes, does stress cause nipple discharge? Yes, there are studies that show stress causes nipple discharge because it is due to increase in the hormone prolactin, which is responsible for the lactation. Nipple discharge in newborn babies. It also normal for newborn babies to have a little nipple discharge. So hormone from their birth parent during pregnancy cause this to happen. It should go away on its own within a few weeks. But suppose if it doesn't go in 6 weeks to 12 weeks, it should be investigated. People who breastfeed may also leak milk-like fluid after ending breastfeeding. That is normal. So take-home message, suspicious discharge, especially clear and bloody nipple discharge, need urgent evaluation. Patient need good counseling that if any pathology, early detection is treatable, and every discharge is not a sign of breast cancer, but bloody discharge from the one side of the breast on it is coming spontaneous, it is alarming sign, then she should think is something wrong is going to happen in her body, in her breast. So these are the references I took. And these are the thank you from the breast survivor for each and every clinician who spread the awareness about the breast cancer. So not a single patient should get the cancer. So thank you so much, Dr. Ritu, for giving this opportunity and this platform to talk about this nipple discharge and to make the public for the breast cancer that is the leading cause these days for the mortality and morbidity is, and also it has increased, is more than the cervical incidences are more than cervical cancer presently. And one in 8 women is really getting the breast cancer. So thank you, dear.
Thank you, madam. Thank you so much for such an excellent lecture. Lot of appreciations we are getting. Madam, will you stop sharing the screen?
Yes.
Yeah. So we have received some questions also. Yes. Renu madam, very busy practitioner from Kanpur. Renu madam is also a great accommodation. She usually tries to join my all webinar. Thank you, Renu madam, for joining. Renu madam has given the comment, excellent talk. Every point has been discussed very well. Thank you, madam. So Suman Sena madam has also joined. Madam is also giving the comment, excellent talk, Tarni madam. Dr. Tripti Bansal has joined from Lucknow. She is also writing the thank you so much, ma'am. Dr. Tripti, good to meet you. KGMC is also my alma mater. And there is question from Dr. Ritu Dua. Hi, Dr. Dua. She is from Mirzapur. She has written the good evening, madam. So many times the patients are coming with milky discharge from both the nipples, but TSH, prolactin and mammogram all are normal. Then how to treat?
Then in that case, I just told she should be advised for the MRI CT of the pituitary. Pituitary fossa, definitely they will take from the fossa. There may be some like a small pituitary tumor that should be excluded.
Yes. Thank you, madam. Madam, our friend Dr. Samuel Ajabur has joined from Africa. Welcome, Dr. Samuel. And Dr. Archana is also writing very informative talk. Shivani, please don't leave. I have to show one video at the end. Thank you for joining. And Dr. Anuradha is also. Yes, madam.
I just want to add something. If there is nipple discharge, discharge from both the breast and the thyroid is normal, prolactin is normal, then we can wait for some time. Sometimes, as doctor has already told, stress is also a factor. So we can get prolactin with us repeat. And if it comes to normal, then it's okay. History of stress is very important. So this is just my addition to already. Doctor has already told it is discharge can be normal. We can just give Capgoli. But stress is also important. She has mentioned. So we can wait for some time before going for pituitary CT scan and MRI.
Okay. Thank you, madam. Thank you for your comment. Let me check more. Madam, besides this, I have some comments in the YouTube also. Tarni, madam?
Yes.
Madam, we are not able to see you.
हाँ वो एक्चुअली जरा डिस्टरबेंस हो गई थी हाँ
अच्छा, okay,
विवेक का
no
फोन आ
problem, no problem. Acha, acha. Madam, there is one comment from Dr. Tariq Sheikh. He is joined from Dhaka, Bangladesh.
थोड़ा
He is
कम कर
congratulating for me and you
कम
for
कर
such an
देगा
excellent program. And another comment
कर्म आवाज
is from Dr. Farha. She
आवाज
has
नहीं
joined from Dhaka. She is also writing, keep on taking such of topics. These all are very informative. So thank you, madam. Thank you once again for giving such a beautiful talk, covering all the points. So before we wind up, I again want to share my screen.
कुछ पूछ रहे ना क्वेश्चन तो समझ में सुनने में नहीं आया
नहीं मैम क्वेश्चन नहीं सब एप्रिसिएशन आ
ओके
रहे हैं
ओके ओके मुझे ऐसा लगा वो एक्चुअली मानसी का फोन आ गया था ना अमेरिका से तो थोड़ा सा
अच्छा
सा सुनने लगे
हाँ बहुत सारे एप्रिसिएशन आ रहे हैं बांग्लादेश की डॉक्टर्स ने काफी अप्रिशिएट किया है हाँ
थैंक यू
जो
डियर
YouTube
जस्ट
से
बिकॉज ऑफ यू
नहीं मैम
इट
मोस्ट
वाज सो
वेलकम
इम्पोर्टेंट इशू स्पेशली इन दिस मंथ और वो भी नवरात्रा का एज यू टोल्ड ऑलरेडी
जी हाँ So I am thankful to my dear friends, those who all have joined. So before I wind off, so there is one small video for my dear friends dedicated to Tarni Madam, Dr. Shivani and Dr. Neelam. I hope Shivi is here.
ये रंगीन है फैशन ये एवरग्रीन है गदर के हमने खुशी की बोतल फुल हम शौकीन है हम दिल से क्वीन है हम दिल से क्वीन है बचना है शहजादों हमसे हम दिल से क्वीन है हम दिल से क्वीन है हम दिल से क्वीन है
Thank you once again, madam. So before we wind off, we will should be grateful to our Mata Durga Rani. One small song tribute to the Mata
हमारे
Rani.
बिल्कुल
Then
माता
I
दुर्गा
will
रानी
take-
वाली फोटो आ रहा रही तो बिल्कुल डी स्ट्रेस कर दिया आज ऋतु ने ये फोटो दिखा के दोनों रियली वंडरफुल
एक ही मिनट हाँ This video I will show, then I will take your comment.
हे काल रात्रि है कल्याणी तेरा जोड़ धरा पर कोई नहीं मेरी माँ के बराबर कोई नहीं तेरी ममता
So thank you once again. So I will, as my all the talks are always start and end by with the Mata Rani blessings. So we all pray to Mata Rani to keep sharing her blessings on us. And thank you once again, all of dear friends. Rani madam.
yes
Madam, see, Dr. Kariman is still there. She is the president from Lebanon Society. So,
okay
hello, Dr. Kariman. She is from Lebanon. She has joined. She is still here.
ये क्या हो गया ये गड़बड़ हो गई कुछ है
नहीं कुछ
Okay.
गड़बड़ नहीं होगी मैम. We can hear you. We can hear you, ma'am. We can
Okay.
hear you.
okay
Yeah, Dr. Sushila has also joined. Dr. Sunita, yeah. So thank you, dear friends. Now my series is started again. Next week, I am coming with Dr. Shadi Salim, President of Arab Society, on a very important topic, endometriosis and infertility. Post that, on the another week, I am coming with Dr. Zina Tara Sheikh on the menopausal issues. Again, after that, with Dr. Abu Bakar on the recent guidelines on PCOS. I will declare we will post the flyers, but tomorrow all the flyers we will post. 2 more messages we have received. Dr. Usha, I am not able to see your questions. Can you please write here? Dr. Sunita Kumari is writing the excellent talk. Dr. Usha, I think I had missed your questions. If you can rewrite here, so that will be great. No, I am not getting your question. So with this, we will wind up, madam. Thank you, madam. Thank you so much.
बस तुम अपने फ्लायर सब पोस्ट कर देना so I will also make to join them okay Okay.
Yes, sure, madam.
कई बार मिस हो
Sure.
जाता पर वो थोड़ा सा ब्लॉक कर लेंगे डेट्स को ना So I will be
Sure,
okay.
sure, madam. Sure. Thank you to Taneja sir also. I also request Dr. Taneja sir. I will take sir's date also for one of the upcoming session. Sir is also a very excellent orator. So definitely we all need some good lecture from the sir also. So I will take
Thank you
some.
very much.
Yeah.
Thank you.
Thank you, sir. Thank you, sir. And at last, not the least, thank you so much, dear Chitra. I know today Chitra is not on duty, but thank you, Chitra. You have joined for my webinar. And thank you, Shield Pharma, for providing the platform. With this, we will wind up, friends. Bye-bye. Good night.
Bye, dear. Good night. Happy Naratra.
Bye.
Okay.
Happy Namaste.
Happy time.